Hello, how are you? Thank you so much for attending. Today is another unbelievable day in this new world order. Last month, we had an amazing experience with our first stop. You know, the biggest strategic point at Cqcs Innovation Latam is that our incredible speakers make their presentations in English, and we translate it to Portuguese and Spanish simultaneously, making sure to connect our Latam in equal base. You can imagine my frustration when the simultaneous translation did not work. But what should be the worstest moment of my life became one of the most beautiful experiences of it. Everyone worked very hard to fix it. I can't forget Rafael from Cyclic offering to make 3 times his presentations. The original in English and 2 times Spanish and Portuguese, so I could have some time to try to fix the translation. And didn't work. So Hilario came to me and said, hey bro, let's make that really international. Marcelo speaks Portuguese, I speak Spanish, and Jonathan speaks English. This keynote speakers was amazing. We changing the order of the speakers. They're making their presentations slower so the Latin people could understand Portuguese and Spanish. And the Q&A was translated in 3 languages without being simultaneously. And that destroyed the agenda of everyone. 1 hour and a half event took 3 hours. And that moment, because that craziness that killed the agendas, I'd like to say sorry for Mr. Jonathan Kalman. I know he had some things to do at that night, and he got late in his meetings. Sorry, bro. And you know, the audience was the surprise. You guys were amazing. You really touched my heart. When I was very close to throw the towel, I noticed that no one left the room. 350 people kept there without simultaneous translation for 95% of the time. Wow. And still there are some people who ask me why I love insurance. That's because we are used to support each other mutually. So I'd like to thank you all who stayed there until the end. And also say again, I love you. Let's talk about today. Today we're going to discuss about pandemic impacts in the health insurance market. We're going to have first the InsurTech of the month, which is Players Health. With CEO Tory Brooks is here with us. Jonathan Kalman introduced us in a very nice C-suite meeting in Philadelphia, in St. Joseph's University, an amazing encounter. And our keynote speakers who make the main panel is going to be Mr. Lior Baruch, senior doctor, who came from the front line of trauma to insurance market to support taking better care of our insured people. We'd like to thank you, our friend Eduardo Comer, who gave this gift to me, because Lior now is another friend, another special friend that insurance gave it to me. We're also going to have Mr. Flávio Bitter from Bradesco Saúde. Bradesco Saúde is the biggest insurance health plan in Brazil. Bradesco is a company having been together with Cqcs since the first steps. And when I was talking with my friend Leonardo Freitas about this conference, he said, hey, we have a top gun here. If I was you, I would invite Flávio Bitter. We did. And now I'm very pleased to have Flávio here with us. And thank you, Leozinho, once again. You're a great friend. And we also have in here Mr. Vitor Navarro, the president from Global Excel. He's a globetrotter, having been all around the world, and he knows a lot about insurance in Latin America. He was indication of the all-time friend, Hilario Trigo, who has been very present and supportive in my journey in the innovation field, always searching best ways to protect more our society gains, properties, and lives. But for you all have a better moment here today, I would like to give you some tips. The chat will be open our conference, so you can hit each other and making friends and making business. We're gonna have first the pitch of the InsurTech of the month. After that, we're gonna have the main panel, the pandemic impacts of the health insurance market. After this panel, we're gonna have the Q&A session. Please remember, to make your questions for the Q&A, please use the Q&A button on your screen. And if you need translation, you also have the translation button on your screen. For now, I'd like to thank you all. Thank you for those who attend our invitation. Super thanks for your panelists who are gonna guarantee the high level of our content. Super thanks and gratitude for Cqcs InsurTech Innovation sponsors and attendees who already registered, who allowed us to make that in 2021 in June. And I'd like to tell you a little bit about Mr. Tory Brooks, who's gonna be our first speaker. Let me get to hear his notes. Tory Brooks is a motivated entrepreneur, born and raised in south side of Chicago. Tory became a quick stand at WSU as wide receiver. After graduating, Wyoming State University, Brooks went to play football professionally in Europe in the CFL, Canadian Football League. Unfortunately, his entire football career was plagued by injuries and ultimately came an end by the time he was 23 years old. About the insurance cut Tory's football career short, they also gave him insights into a problem that needs to be solved, which led him the creation of Players Health in July 2015. He believes the more he knows about the environment we are exposing our athletes, to be safer that we can make the sports that they play every day. Please welcome Mr. Tory Brooks.
Oh, hey everyone, Gustavo. Thank you so much for having me. Really excited to be here with you all today. I really appreciate that introduction and really honored to be the InsurTech of the month here. What I'd like to do is I'm going to start off really just give a just share that I didn't normally come from the InsurTech industry. I think, but I love everything there is about insurance. I love what it means to be a social good and support these organizations is a huge part of what we do. What I will say is that Players Health is a bit different. When you think about overall InsurTechs, is that we are really focused on the risk management aspect of these organizations. We want to make sure that sports organizations in particular are really focused on creating that safer environment. So I'm going to share with you a little bit about who we are, what we do, why we're so passionate about what we do, and how all that translates into insurance. As you all know, the pandemic has affected every industry, but sports, I believe, is probably one of the most visible industries that it has impacted. And we're really excited to be able to support our organizations with this. But the overall mission for Players Health is I think it's a very simple mission, but it's definitely not easy. Our mission is to create the safest environment possible for an athlete to play the sport that they love. Now, what does that mean? I think that can mean a lot of things. And I think we look at organizations, we support a number of organizations today. Players Health Sports, well over 1,250 sports organizations with over 50,000 teams and well over 1 million athletes today. And these are just some of the organizations that we support today, just to give you over a high level. And from very large organizations to the U.S. Adult Soccer Association to very small organizations. We support these organizations in a number of different ways. But when we look at an organization, we look at an organization from what we call a circle of care. In terms of creating a safer environment and fully understanding the risk, a lot of these organizations have a ton of roles and responsibilities, policies and protocols that they should be following. And all of these policies lead to exposures, claims. How can we go about helping mitigate that? And so we have a comprehensive risk management suite that we do, and we support these organizations and really helping them fully understand how they're managing their risk today and how we can prevent them from having claims in the future. And so, as you see, we hit on the injury management, which is the treat side. We focus on the overall performance of the organization. We help protect the athletes and the organization. And lastly, but definitely not least, we help them with the insurance. And so when we sit down with an organization, the last thing we talk about is insurance, because we want to make sure that they're worthy the coverage that we're going to be providing for them, and also making sure that they have a very comprehensive risk management suite so that they can get a good, so that our carrier partners can understand that these organizations are above and beyond any risk that they would normally write. And so everything starts with our assessment. I think what we focus on with these organizations is ensuring that these organizations have a very clear understanding of exactly what is happening within an organization. Every organization has a policy and a protocol that they should be following. And so we take them through an assessment that gives them a very clear understanding of the health and safety guidelines that they should be following. And all of that is what is broken down into what we call the 7 pillars of organizational sport safety. Those pillars really give the organization a score based on how they're implementing these policies, and this drives us to go to work. What implementations do we need to do to ensure that those organizations are following these protocols so that they are creating that safe environment? And then all of this really starts with policies, protocols, and return to play. COVID return to play has really been a big focus for us as of late. I think risk management used to be a very boring topic that a lot of organizations didn't follow. I think it's the top of every organization and industry's minds, and sports is definitely not absent to that, to having to focus on that. COVID return to play has been a big part of how do we return these sports back to play. We're seeing that with the NFL. We're definitely seeing that with the Premier Leagues. All of these organizations have to come up with a protocol around how they were going to get these athletes back on the field, court, ice, in a safe way. We help support them. Unfortunately, abuse prevention is something that organizations struggle globally. A lot of sports organizations, from youth organizations on up, have dealt with abuse, and our platform helps them manage that as a whole. Of course, background checks and concussion has definitely been a huge part of sports in general, and how do we go about mitigating that risk? And then making sure that our overall coaches are educated and understood exactly what they need to do. And so this is just an example of what and how we're supporting organizations in returning back to sport. One of the things that we focused on is really we need to create a safe environment so that everyone is properly screened. All of our athletes, when they come in, they have to go through a daily attestation or daily symptom survey. Have they come in contact with COVID? Have they had any symptoms? All of this is really important. And because predominantly a lot of our organizations are youth sports, making sure that their parents are filling out these surveys, making sure that they have the proper waivers, all of this leads to liability and managing liability. And so before they can come in contact with practice or games, they need to take this attestation. They need to make sure that they're properly screened. And then once they've cleared, they're now allowed to go to practice and games. We support thousands of organizations with doing this, and we want to make sure that they have a proper return to play. This is just an example. Of course, injuries is a huge part of what we do. Injury prevention, I play professional football, as Gustavo said. I have 3 bulging discs in my neck and I end up tearing my hamstring off my tibia. How do we support these organizations with ensuring that these injuries are being managed in a proper way? And so the data that we collect with organizations following specific protocols around risk management, around injury management is very important. And so we have a system that ensures that they're following that protocol, and then it gives us a huge insights, top 5 injuries, the location of these injuries, on how we can better support them from a treatment perspective and a training perspective. And then, as I said, I talked a little bit about abuse prevention. We have created, hands down, one of the most robust abuse reporting applications on the market. We want to make sure that any athlete, coach, or parent can anonymously or privately report an abuse incident. And then we have a number of investigators that investigate on that organization's behalf to ensure that they're following proper protocols and that we don't have another USA Gymnastics or Penn State. Unfortunately, there are so many sports organizations that have fallen prey to abuse incidents and the management of it. We've created a platform that ensures that these coaches, these organizations are following all of the great protocols. And so all of this really leads to administration. I, as an administrator of a sports organization, have a number of coaches. Some organizations have 10 coaches. Some of our organizations may have 10 to 15,000 coaches. How do I ensure that all of these coaches are taking the proper steps to be around kids, to be in a space where they can provide the best experience for these athletes? We have a platform that tracks all of their credentials, making sure that they have their background check, making sure that they have their training. All of this is now done in one platform. And so how does all of this leads to insurance? Well, we've partnered with some of the largest insurance carriers in the space. And normally when a sports organization was looking to place their coverage, they'd be working with the broker, and 9 times out of 10, the carriers wouldn't have the data that we're providing. They wouldn't know how many coaches have taken their background check. They wouldn't know how the organization is actively managing their COVID response. They wouldn't know exactly how they're managing injuries. But with our platform, they're getting that data in real time. So they now understand that this organization is a different risk than every other soccer program that they would insure. And so with our organization, we're able to provide a level of insight to our carrier partners that truly doesn't exist in the marketplace. And on top of that, we're a licensed insurance brokerage. So we support the organization. The more implementation they do and the more engaged they are with our risk services, the idea is that the more affordable their insurance should be and the better scope of coverage they should have. It's a full service risk management and insurance platform. So we've created a platform that also supports the organization with placing their insurance. So for the first time now, these sports organizations have a true risk advisor. We're helping with their COVID response. We're helping with policies, protocols, and we're also helping with the placement of their coverage. And so, as I said before, our overall mission at Players Health is very simple. It's definitely not easy. We want to create the safest environment possible. And we believe that insurance is a part of that mission. And so we're really excited. If you all have any questions, you want to get to know us a little bit better, we just launched our new marketing site, playershealth.com. Please go check us out. I'd love to hear from you, and Gustavo and everyone with the CQC community. Thanks for having me. I really appreciate it. Talk to you soon.
Great pleasure, Tar. Please stay until the end because you got a Q&A. So if people want to make some questions for you, they can do that directly here. And also you can talk a little bit more the curiosity of our audience here. But thank you so much. And now let's go for our main panel. My friends, what a crazy world. Who could imagine we're going to be 18 weeks quarantined? Who could imagine we won't be able to hug our friends? And our industry are used to deal with bad moments. You know, we are the good friends in the bad moments. We are from the insurance market. We are that people you can trust when you have a problem. And in the pandemic moment, we are having an extra duty. And really, really, really interesting how hard it is to deal with it and how fast we turn it to the digital. Insurance industry probably was one of the fastest industries who changed to the remote without losing the services and without providing our obligations to take care of people in hard moments. So our panel today, it is focused in understand better how pandemic impacts our industry. We choose very, 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 very well done professionals. And the first one I choose was Mr. Tory Brooks. And I want to talk a little bit about him with you guys. I was talking with my friend Shurek, Edu Komor, and I said, I'm going to make a panel. This would be amazing if you could have designed something really special. Because as you should know, today is the second stop of Cqcs Innovation Latam. There's one conference with 6 stops. So don't bother all day long or 2 day long. Try to make it really, really light. And we choose to make it in a way that we get one topic at a time, so really could go deep on it and see how we can help our industry and the society in this paradoxical moment. So today, I was thinking about what's the model of our encounters here. We have the Insurtech of the month and 3 speakers. Someone from Latam, sharing a Latin experience. The second, someone from Latam who work abroad, who have an international experience, but is from Latin America. And the third one, a company who really wants to make business in Latam. When I talked to Adu, I said, do you know someone from Latin America who lives in the US or Europe that could help us to be speaking in our conference? He said, oh yes, I have a guy who is amazing. And I'll talk a little bit about him because he's a senior medical executive for Cigna Global Health Benefits. Dr. Leo Baruch joined Cigna International Business in 2012 to manage the healthcare network in Latin America and the Caribbean. He had multiple roles within the organization, such as network vendors relationship management, providing contracting, medical director, and emergency assistance vendor management. Leo currently supports client management and sales from a clinical perspective, serving as well as a thought leadership active member of the Global Medical Wellness Team. He's fluent in 5 languages, as he says without an accent. Leo has a broad knowledge and engagement with complex case management scenarios, as well as patient safety, quality driving healthcare delivery. In his previous expatriate assignment, Dublin, Ireland, Leo served as the medical and network manager for Latin America. In addition to his work in the insurance industry, Dr. Baruch is a general and trauma surgeon with extensive experience with the mobile emergency medical service in the city of São Paulo, a huge city. He has also taught medical students and residents as a guest lecturer in the university from which he graduated. Leo holds also an MD degree from Federal University of São Paulo, same institution for his medical residency. Leo also has an MBA in health system and health management from Fundação Getúlio Vargas. Please welcome Dr. Leo Baruch, my new friend.
I think you have oversold me, Gustavo. Let me share my screen, and I hope that this works. You just please let me know. Can we see the presentation?
Yes, we can.
Yes.
Excellent.
Great.
So, good afternoon, everybody. And again, thank you, Gustavo, for the opportunity to share the virtual stage with these fantastic subject matter experts. I'm personally really thrilled. And just a little piece of housekeeping first. Although I would love to represent my employer, Cigna Global Health Benefits, on this presentation, the whole content here relates to me personally and exclusively, so I don't get in trouble with public relations or branding or legal or even compliance. And although we only have 15 minutes for this presentation, I do believe that we will be able to share among ourselves some concepts that are probably common to everybody, yet they may spark some good topics for discussion down the road. When Gustavo asked me to join this event, I was actually looking for an impact opening line on the internet, usually those pictures with a catchphrase. And then I landed on this one, right? However, and throughout the research, I actually found a genuine one that is linked to Dr. Martin Luther King, and which says, "We're not makers of history, we are made of history." Now, why this specific quote caught my attention? For the simple fact that medicine, public health, and history walk hand to hand. But interestingly enough, and we will see this throughout the presentation, although history teaches us great lessons, we, human beings, tend to demonstrate a short memory behavior. Why is that? For the simple fact that we all have a selective process of memory. We all enjoy recalling positive and remarkable memories, and we all dislike to resurface distressing memories. Now, here's the problem. A disease that has taken more than 600,000 lives and continues to take cannot be tackled just as a lesson not learned from history. It has to be challenged with the most effective measures so we can spare as many lives as possible. And I'd like to share with you some pictures on how pandemics have impacted humanity historically and how we have definitely learned some lessons, yet We are far from optimal, and how there are several resembling factors around these scenarios. So there are numerous pandemics I can refer to, but the earliest recorded pandemic happened during the Peloponnesian War. 2/3 of the population in Athens actually have died, and the disease is suspected to be one of the contributing factors for the Spartans to win the conflict. Fast forward to the year of 1350, we had the Black Death, or in better wording, the second outbreak of the bubonic plague. The disease traveled from Asia to Europe, and it has changed the continent's history by wiping out over half of its population. This picture is actually of a so-called plague doctor, and what he's wearing over here, the costume and the mask, is one of the first recollections of a medical personal protection equipment. Also, it is credited that the Black Death has ended due to the measures such as what you have mentioned, Gustavo, quarantine. 200 years later, and following the arrival of the Spanish into the Americas, we had many infectious disease decimating Mexico and Central America population. Around 50 million people died. One of them, a specific disease called smallpox, is known for having reduced the Aztec Empire population in almost 80%. 300 years later from that, we had the third plague pandemic, which started in China and caused roughly 15 million casualties. This specific pandemic actually was a great insight to what happened during the bubonic plague, especially how the infection spread to humans. And then we had the Spanish flu around the end of the First World War, the deadliest pandemic in recent history. Numbers are on the verge of 500 million infected people and 50 million casualties. Now, interestingly enough, Spain had nothing to do with the Spanish flu. It was actually Spain, one of the countries that remained neutral to the war. Hence, it had no censorship to the media. So because they were the ones heavily reporting the cases and casualties, they were nicknamed after the disease, most likely incorrectly. And there are several lessons from the Spanish flu pandemic that we have learned, and it's a very similar scenario to what we're facing today. Number one, country leaders do make a positive or negative impact on a pandemic scenario. Second of it, early restrictions such as social distancing reduce casualties. And last but not least, young and healthy people also get infected and die. So wearing a mask is crucial. And with that, people were incentivized to wear masks, even the meow-meows for the family portraits. And then obviously people started to wear them in a wrong way, or wearing anything but a mask to cover their face, and even wearing face shields. The authorities and the media started to propagate social isolation measures, and even campaign hospitals were built to supplement the need of hospital beds. Now, it's really how interesting history has painted a portrait here. The scenarios are from 1918, but very similar to 2020. Now, let's pause and let's remember how was our life back in 2019, right before the pandemic started, and we all got flooded with news about the coronavirus. So in 2019, the Notre Dame Cathedral was barely destroyed by the flames. The last details about the UK's Brexit were settled. China and the US were battling a trade war. Waves of Central Americans headed to the Mexican-US border. The Brazilian Amazon burned down. All sort of news we'd hear and see as business as usual. But then, around October, we heard about people getting sick in a Chinese market. It didn't take long until this, the new coronavirus, was discovered to be the source of a very infectious disease and lots of conflicting information. Let's pause again and let's talk about the healthcare landscape in Latin America very quickly. So according to the latest UNDP data from 2019, This is a list of Latin American and Caribbean countries ranked by the highest Human Development Index. Now, remember that Human Development Index is a statistical tool used to measure a country's overall achievement in its social and economic dimensions, such as health of people, their level of education attainment, and their standard of living. It is not just an isolated economic growth indicator. So what does this table show us about Latin America? Purely social and economic inequality. And the disparities will continue to exacerbate social dissatisfaction over and over unmet expectations. And discontent with the inability of the political establishment to deliver improvements. And this is the fuel actually for the whole political rallies in this region. Just out of curiosity, the first country in Human Development Index is Norway, one of the top 3 countries in the world for happiness, contrasting with Niger, where this is actually how you propagate public healthcare measures in a country that has an average of 2 years of schooling. Then what about the healthcare expenditure? Latin America on average spends below the world's average, far from what the European Union does, and certainly a long way from what the US does. Now, just to be clear, the US healthcare landscape is exorbitantly expensive and certainly not ideal. And although Latin America spends on average $900 per person per year on healthcare, and the US an average of more than $10,000, I'd say that had we have the chance to move towards ideal, that would be the European Union and not the US. Also, and just to give you an idea, 20% of Americans today are in collection for medical bills due to the exorbitant costs and confusing billing system. Another fact, Starbucks coffee, for example, currently spends more on healthcare rather than coffee beans. What's the catch here? The catch is access. If you live in any Latin American country, this is no news for you, right? There's a huge discrepancy and dichotomy between the public and the private sector when we speak about healthcare. The public healthcare system is typically overcrowded, which is literally prohibitive for a pandemic scenario. It is underfunded and far from being managed in an optimal way. On the other hand, and the complete opposite of it, and assuming one can afford it or receive it as a benefit, it is the private healthcare access. But as much as this may resemble comfort, let's not forget that having access to a public healthcare system, and as faulty as it is, it means having a safety net. Yes, and unfortunately, clinical outcomes also differ in both worlds, but it's also the biggest feature or difference between having a place to receive care or to be left alone to die, as harsh as this may sound. One of the great achievements that we have seen throughout the pandemic in Latin America, and certainly something for other countries to learn from, was the public-private partnerships. Campaign hospitals were funded and managed by the private sector. Outdated hospital facilities have received brand new equipment, even through donations, and many other acts that make us remember why we're humans in essence. So let's have a look on what actually happened with Latin America from a COVID-19 perspective. What you're looking at is a linear representation of the top 7 Latin American countries from a number of cases perspective. This data is actually from March 1st through July 15, and my apologies for the outdated stats, but I actually had to deliver these slides to Gustavo by last Monday. Brazil has actually already surpassed the 2 million cases threshold by last July the 16th. Interestingly enough, and when we look at the logarithmic curve, which is this one, and certainly aiming at a curve flattening what we have mentioned always, it seems that none of these cases are there yet. From here, if I'll take you to the total number of deaths in Latin America, Brazil is leading it, and unfortunately steady, followed by Mexico, Peru, Chile, and so on. However, what I wanted to highlight on the next slide is not the total amount of deaths, as you're seeing here, but in reality, the mortality rate on the different countries. And that specific stat, the mortality rate, actually shuffles the countries' rank a bit, as you can see. Now, why does Peru has the highest mortality rate among all Latin American countries? Although Peru was one of the earliest countries to impose a quarantine as early as March, roughly 15, 16, border closures and even curfews, those measures were ineffective. Reason being, more than 40% of households in Peru do not have a refrigerator. So people have to go out since they cannot stock food. Another factor, Peru has one of the highest informal sector with as much as 70% of the employed population. These kinds of jobs are unpredictable, turning social distancing very challenging. Also important, 38% of Peruvians have a bank account. So stimulus payment or digital approach to it is barely impossible in a large scale. Second of the list, Chile. It's a bit ironic, right? Because you heard me saying that out of all Latin American countries, Chile had the highest human development index throughout the Latin American countries, right? Well, despite of the officials' reassurance that the country was well prepared to face the pandemic, the virus actually exploited the cracks on the Chilean society. Residents had to apply for a pass online before they could go out for their homes, even to buy groceries. Then by late April, things were going so well that Chile was starting to talk about reopening. And then in May, it actually surged, right? The high numbers are not just a reflection of an efficient testing infrastructure in Chile. Chile's per capita testing rate is lower than most European nations and almost half the rate in the US. Also, Chile is one of the most unequal countries in Latin America, according to the World Bank. Chile's initial plan to deal with the coronavirus outbreak, which at first affected mainly the elite in Santiago, just failed to recognize that the affluent have maids, have gardeners, have cooks who actually might also get infected. And when the virus started spreading in lower income neighborhoods, it quickly got out of control, and the numbers reflected heavily and mainly on those who relied on the public healthcare scheme. Third country, and the last one I will tackle, is my beloved homeland, Brazil. And the country continues to fail miserably since very early stages, given to the very critical points I'm about to talk about. It seems that the country is not facing a pandemic, but actually under a pandemonium. Brazil is so split up from a political perspective that even science has turned into a dichotomized, not to mention that the country minister of health is an interim one and the third one in a period of 3 months. The country has taken some very interesting measures, such as building campaign hospitals in large metropolitan areas due to the whole system collapse fear. But Brazil is, for now, unfortunately, drifting as we speak. Now, you have probably realized by now that I have not focused on Mexico. People usually say that once you talk about Brazil, you must talk about Mexico. I personally disagree. Mexico only looks alike with Brazil for its exquisite food, beautiful nature spots, and probably by great people. But from a healthcare perspective, Mexico resembles way more to a big Indonesia rather than Brazil. The healthcare insurance market in Mexico is ranked 4th throughout the insurance business line, behind life, behind auto, behind property and casualty. Also, from a pandemic perspective, the resemblance with Brazil is more towards how long this first wave will be lengthy, as well as how it might be moving away from main metro areas towards inland. Let's flip the discussion and let's tackle some successful cases. First and foremost, Uruguay. Political consistency, mandatory quarantine, allied to a nationwide favorable and acceptable social distancing policies have played a key role to the country's success. All of that, despite of the country being the 4th highest rate in testing in the world. However, it seems that Uruguay having one of the lowest rates of poverty, it may have been a positive pillar as well. Secondly, Paraguay, a country with high poverty and weak public healthcare system, has controlled the pandemic with very strict governmental measures, such as early borders closure, as well as mandatory shelter in place. Lastly, Costa Rica, who has a robust universal healthcare system covering almost 95% of its population. Costa Rica has mobilized its institutions to respond to the pandemic in a very cohesive way and strong fashion, and an incredibly collaborative from a political environment. It certainly helped a lot that it has a society that follows official instructions and acts responsibly. Now, what about the private healthcare insurance landscape? Wherever it has touched base, we saw some very interesting measures in several countries, such as telehealth access or even expansion of its availability to non-health product customers. Mexico is a great example where a very large insurance company offered telehealth access to its auto insurance customers who were not necessarily health insurance customers. One of the biggest positive legacies of this pandemic will be telehealth utilization in the future. Second of it, out-of-pocket waiver when related to testing and or treatment of COVID-19. Some organizations have granted a monthly client premium pass. Others have revisited their margin and offered a discount upon renewal, and so on. Customer had their out-of-pocket waived if the claim was related to the either diagnosis or treatment of COVID-19. On the other hand, healthcare insurance or healthcare insurance companies actually have seen their claims volume plummet given the halt on elective procedures. However, they have to be very careful. Once we come back to normal life, and we will, they will most likely see a spike in volume, so they better prepare and have a caution. I'm not saying that insurance companies have not seen claims at all. I'm saying that there was an abrupt shift on claims experience and trend. And interestingly enough, to the providers, to hospitals, the average COVID-19 hospitalized patient is not a profitable type of business. Obviously, in a scenario like this, and any revenue is better than nothing, right? But the profitable procedures to providers, such as cardiovascular, orthopedics, and others, are reduced to a minimum, probably done only on an urgent basis, so you can understand the struggle. Interestingly enough, private insurers are actually challenged with what could potentially be the future state. Given the huge economic impact that COVID has established globally, there might be a potential market shrinkage. So companies downsizing equals less membership to insurers, meaning less revenue. However, this scenario is still unclear. So probably underwriting is working twice as harder in order to make the best shot. Another item is the general population, customers, brokers, partners, as much information as possible. So sharing data, sharing information helps in every way, everybody. A very important topic I would like to tackle, taking care of the most valuable asset an organization has, its employees. So actions such as deploying and incentivizing work from home was crucial from a workforce perspective. Not sure if this is clear to all, but working from home was a huge disruption to big organizations. Having to deploy an army of people, arrange IT resources, connecting them, supporting, and towards enforcing social distancing was a great business continuation plan fire drill globally. And the ones that have made it smoothly and effectively have certainly gained leverage from their employees on empowerment and also from a great place to work perspective. And very importantly, charity. Wealthy organizations making a huge impact on smaller communities, local support, donating and helping whenever and wherever possible. It makes a huge positive impact on local populations that certainly appreciate the every little helps policy, inclusive of hand sanitizers, masks, and so on. Folks, just to finish here, I could tackle this presentation from a completely different angle, many other factors, but with only 15 minutes and so much to talk, and I'm sorry for the speed that I talk, I hope that this was helpful, and I'm really looking forward to listening to my colleagues and further questions.
Thank you very much, Lior. I really love it, and I'm really impressed how much information we got from these minutes. Impressive how the procedures we are doing today are not new. masks, campaign hospitals. That's been part of our lives.
Yep.
And another point, it is how each country in Latin America have a specific scenario. Each landscape, which each peculiarities, and that make us really think about. And amazing for this presentation. I really thank you very much. I need to tell you that I have a really high expectation about yourself, but you really make it over. So I did not make it up. If you don't mind, you should don't stop sharing your screen, so you can get bigger me and you on screen.
Will,
okay.
Pause share or however stop whatever. I don't. Yeah.
I'm showing your screen. I don't know. We're plenty of time. We're
there
doing.
you go.
There we are. There we are. And I would like really to say that, and it's very good when you have some time, to stop and take a look from the outside. I call that here the helicopter view. If you're in a problem, and if you're in a situation, I got a helicopter here. You can see here the audience. Can you see the helicopter? I got a helicopter. Remember me. Come out and take a look. So thank you very much. And I'm sure we already have a lot of questions for you in the Q&A. So please, audience, keep asking the questions because I think the best is the Q&A. And more than 300 people here with us. So thank you all. And I hope you're liking that. You're amazing, man. Thank you so much.
Anything for you, Gustavo.
Right now, I would like to invite my other new friend. I met him before. We have been together sometimes because Cqcs and Bradesco have been together for the last 18 years. So we see a lot of turnarounds of those people in companies. And Flavio was a very, very luck choice for us. So Flavio has been in Bradesco at the last 19 years. He's also part of the board of Odonto Prev Horizon. He also have an AMP, Advanced Management Program from Columbia Business School, and a lot of training programs from strategy, leadership, and finance, and the main global universities like Harvard, Stanford, Washington, Chicago. And what's the most important point having Flavio here? He is living the pandemic on a daily basis in Brazil, in the pandemonium country, as Lior said. So first of all, thank you, Leozinho, once again for introducing Flavio. Again, to me, Flavio, thank you so much for your time. And please, guys, welcome Flavio Bitter from Bradesco Seguros.
Thank you so much, Gustavo. It's a pleasure to be here. Thank you so much for the invitation. I'd like to say hello to Lior. Great to meet here again. Great friends. We have already shared information from business to food recipe. A great person, and congratulations for the great presentation that you presented to us. I'd like also to say hello to Tyre, to Victor, and of course to all the audience that we have here. Just a moment, I will start to share my presentation. I hope he's already here. So Lior has taken us from the past to the present with an overview from Latin America countries. I will provide our own perspective here from Bradesco Saúde in Brazil, but I will take a little bit more of time to discuss a little bit more about the legacy of this whole pandemic and isolation and this digital transformation. I think all the companies have excelled during this period. So first, just a few information about Bradesco Saúde. Bradesco Saúde is the health insurance company, part of one of the biggest financial groups in Brazil, called Bradesco. Our products are very related to quality. People desire our product based because the quality of the product, because of the brand of the company, and also because we have a big national footprint with more than 1,500 cities covered in our portfolio, with more than 47,000 referred network. We also have the highest level according to ANS, the National Agency of Supplementary Health here in Brazil, and it's a rate that covers from healthcare provides to a lot to quality, to satisfaction, and very other aspects. We also were the first Brazilian company that was accredited by a accredited company called CBA, with the joint JCI, Joint Commission International Standards. So it's some of the stamps that verify our quality. Most of all, we are very proud is to have 3.6 million of beneficiaries, of members in our portfolio. More than the 100 biggest out of the 150 out of the 100 biggest companies in Brazil are Bradesco Saúde clients, and we have 12% of the market share in terms of revenue, and we are the leader of this market. So some information about how we are dealing with the COVID-19. Until now, we have more than 5,000 hospitalizations related to the coronavirus out of our members. It is not as bad as Leo perspective here in Brazil, at least for the private market. In the beginning now of this pandemic, we were very we thought it would be very complicated. We even thought that our network couldn't, in a point, couldn't be able to provide healthcare access to all the needs of our members. Hopefully, because of the isolation matters, although I totally agree, there was no cohesion. It's different between state from state, but in general, people respond in a very good way for the social distancing, the use of masks, and this for sure has made all the curves regarding transmission lower. Also, we're here in Brazil comparing to places like Italy or Spain. We were better. The private sector has did a better job on clinical healthcare, provide of healthcare, and our members were last days in the hospitals, a lower need to ICU rooms, and because of that, I think we were able to manage better the COVID-19 here in Brazil. If you see an aggregated data, it looks like we are in a plateau, but that is because we have a huge difference between the regions in Brazil. So we see all the north states now in a very diminished, a very low rates. They were a problem 2 months ago or 3 months ago, and now it's very stable. We see, on the other hand, in the southeast, a plateau, but the main cities like Rio de Janeiro, like São Paulo, we're having a lower rate already. So we are in the coming to the not at the peak, but coming to the lower rates. But we see on the countryside otherwise increase of number of cases, and we see on the south and especially on central west of Brazil numbers still raising. So a very different behavior between states, and of course, this is due to some of the things that Lior was saying about the early adoption of social distancing and very other factors. Now, I think this is a joke I received on my WhatsApp. I think everyone has already received that joke in our WhatsApp. And the question is, who was responsible for fostering the digital transformation in your company? A, the IT team, B, the CEO, D, the CTO, the agile team. And the answer is, of course, C, is the coronavirus. The coronavirus and the need to be at home, the need to use digital instead of having to do the things in the physical and conventional world due to social distance. This was the main thing that excel the digital transformation in companies. And I would like to share some of the figures of Bradesco Saúde. First, we had, since the beginning, more than 500,000 of visits into our website dedicated to COVID. So almost 1/4 of all our members use that website to have information, to have access to some of the service, like telemedicine, like a free number in order to call a doctor, and information about places or information about the disease and how to get a better service in our network. So almost 25% saw that website. This is a great information. We were already on the process of making available the digital reimbursement, so to begin the process to have a reimburse in a digital way. This was already in place, but look what happens on March, on April. Actually, that because of the need to forget what we do in the past and let's start doing things on a different way. Now, 85% of all the submission of reimbursement submissions are done on a digital way and not in a physical way, how it used to be in the past. We were able to launch in a very quick way, integrated with our app, the telehealth. So with one single click, you can talk to a doctor, and the doctor now, because the regulation has changed, is able to prescribe and to help our members to go to the proper pace, or even with single issues to manage their health. With only in the first month, more than 20,000 of doctor consultations were done in this app. So now in my view, I will share some of perspective about what we understand is going to be the future. So first, this daily life. So we are now very used to home office and even webinars. I think this is the way that we are doing here. It's a great example of how can we get together in a digital way without actually having to be in the same physical place. And this is going to be, I understand, going to be quite normal now. We have changes in our day, especially in our day of commutes. I think people won't will be very a problem if someone has to on a daily basis take more than 1 hour, 2 hours of time spending on their commute. So having the ability to be in your home doing your job in a different way, but even more effective way most of the time, and things like quality of life, well-being, is something that it was already a trend, but really has excelled during this pandemic time. On the economy, unfortunately, we're going to face a recession. This is already in place. People, because of this memory of the pandemic, are more risk averse, but that will lead to the need to prioritize expenditures and a more clever, more smart, a more efficient choices. It's something that we need to do. On the health side, first, I think the memory of the pandemic, again, shows the relevance of having a health insurance, a private health insurance, and have a point of access and with quality. This is something that, you know, for safety and for even for a company to provide as a beneficial to their employees is something that's even more valuable. But things like all other things that were already in place, now it's we have more efforts in order to do that. So care coordination, the better use of levels of healthcare provider based on the condition of the patient. This is something that has changed a little bit. Let me explain a little bit more. For example, here in Brazil, we are very hospital-centric in terms of preferred healthcare provider. So people used to go to emergency rooms, to ER, with very simple symptoms or simple conditions. Actually, almost 80% of everything that was that the people would go to the ER, the emergency rooms, were not actually emergency, and could other places could treat these patients with equals or even better efficiency than being on that place. Due to all the risks related to COVID-19 transmission and fear of being in those crowded places, people don't go to the ER anymore for simple conditions and try to use better places or more convenient places and simple places that are equally can treat them. So this is, I think, a new trend. Of course, we're gonna when we're gonna be back to the old normal, some of these will continue. But I think people realize that with telehealth and visiting your private doctor, it gets more efficient, and this is something I think that will stay and going to be one of the legacy of this period that we are living. And last but not least, all the telehealth platforms and digital care coordination. Actually, we had a barrier here in Brazil. Doctors were not allowed by the association medical was not allowed. Now we have a law and also a new regulation that says that doctors during that period can actually provide this kind of service through telehealth platforms. Of course, with all the safety, with all the environment that allowed the doctor to have a better understanding about the problem and provides all the needs or all the information needed. But we understand that this, after the pandemic, won't be back. It's impossible. Members has already tried and are very satisfied with that. Doctors see that very convenient. And we understand that the society simply won't allow it to be back again when this pandemic is over. So it's going to be actually a huge legacy to integrate healthcare and integrate data and information, and to be more effective and deliver a better value to our clients. So I think this is what I would like to show you. Once again, great pleasure to be here, waiting for this great discuss on the Q&A session.
Are you hearing me now? Wow. Great.
Yes.
Now we can. Now we can.
Okay. Thank you so much. And thank you so much, Flavio. I have a problem with my iPods here. And the point it is, thank you so much for the presentation. As you said, this new normal won't be all that new, because you know the big change comes from inside, not from outside. In Christmas, everybody really cares about the other people, and the New Year's party, people don't really care about no one else, only the party. So the point is, what we gain with it? What are the gains? And you was very, very sharp on it. Now we are going to take that's the way I believe. I don't know the truth, but I really believe that we are going to have a new relationship with the digital. COVID did better than CEOs and IT people. We're going to have, for sure, I could say, yesterday my daughter Lara wasn't feeling good. It was amazing that she had telemedicine. She didn't need to go to the hospital, everyone's sick. Because my kids were really small. Me and my wife, Maria, we're always aware, don't like to take the hospitals when because we got in the hospitals, we need to expose them to other people who are sick. They're not really sick and we are exposing them. So I think those are the gains, the digital transformation. And I believe, I hope that those costumes become the laws and we really can go forward on it. And also you were really sharp sharing this moment that we got the plateau in big cities like São Paulo and Rio. And we are having the change from the north with a big crisis in the beginning of the pandemic. And right now it's coming to the countryside of the other regions. And that's the big reflection. What we can keep the gains of all this suffering. So I really would like to thank you very much for your presentation. It's very nice to see you work internationally for Bradesco brand. Thank you to Manuel and all those nice people from Initials and all those great people from Bradesco who always been supporting us. And you and your family to giving this space for us. Thank you very much. Please wait a little so we can have our Q&A because a lot of questions for you too. Thank you so much. Now we're going to have our new friend from Spain and who really dominates New York and Miami, Mr. Vito Navarro. He is the president of Latin America region of Global XL. He reports directly to its CEO, and he is responsible for delivering the Global XL vision, products and services in Latin region. Victor has been with Global XL Management since 2016 and has over 15 years experience in the insurance industry. I told you before, he knows a lot about Latin American insurance. And prior to joining Global XL, Victor held numerous leadership roles with Aon and AIG, and most recently, he was the president of Royal Sun Life, RSA, USA. My friends, please welcome Mr. Victor Navarro. Thank you so much, Victor, to be with us.
Hey, thank you, thank you, Gustavo, and seriously, thank you to all your team at Cqcs, and thank you for the environment. Forums like this are very, very, very important because we really need to create an environment of collaboration in Latin America. As we have heard, our problems do not speak Portuguese or Spanish with Argentinian or Mexican accents. COVID doesn't care, correct? And the solutions that we're going to have to put for our customer moving forward have to be regional wide. So thank you, Gustavo, for supporting these forums. We have presence from 18 countries in Latin America, and that is fantastic. We will all be grateful for that.
Thank you so much, because you brought something that our people from Latin America have been, me and Lario and Hughes and David, Roy, you have been trying very hard to connect everybody, and you got a very special point. COVID doesn't care.
Doesn't care.
So we should not care. We should try to go together as a region. That's why Cqcs invests so much and make it in Latam. And today everything's going well. God, please keep this way. And probably you're going to have more people from other countries in the next edition. So thank you so much, and you got a great point.
And thank you. And at the same time, what an honor to follow Dr. Leo Baruch and Fabio Bitter. What a great presentation. They have touched all the significant highlights. So in my presentation, I'm going to try to make a transition. I'm going to share my screen. So I'm going to try to focus on the impact. We're going to look at it from what we've seen from a regional perspective, and then quickly, I'm going to switch the debate about what the future of care should be. No, we all know that we need to learn that moments of crisis, of this moment of COVID, is a moment of reflection. It's a moment of reflection if we are doing, we as leader of the insurance industry in Latin America, if we're doing the best for the people that depend on us, are we doing the best for our customer, for our shareholders, for our employees? And this is a moment where we need to look forward, because there is going to be a day after COVID, and how that day after COVID may look like. Some of you may know Global XL, some of you may not. So as is typical in this presentation, I'll dedicate a few minutes to explain who we are. We are a large organization. We are known as a TPA, or a healthcare administrator. We have more than 1,000 employees in 8 countries. We manage around $2 billion in claims for insurance companies. So our clients are insurance companies around the world, and we are proud to count with most of the insurance companies, almost 400 insurance companies in 80 countries. We're independent. That means that all we have in the top of our mind is to do the right thing from a medical outcome and from financial outcome of that client. We've been helping Latin Americans for more than 25 years. And in the market, we were traditionally known for helping when Latin Americans wanted to access care in the US. People that had cancer or for a transplant, and they have a policy that covers for major medical expenditures in the US. And we manage for that process. And for that, we are still significant market leader. But our independence, our relationship with all these different payers or insurance companies around the world give us a unique perspective, because we sit in a unique place between the provider of the health, the patient, and the one that is going to pay the claim. So we're going to share in my brief presentation in some of the findings that we have with COVID so far. So at the beginning of COVID, our main concern that maybe some of the insurance company were not going to cover for COVID expenditure. They were going to claim that a moment that it was declared as a pandemic by the World Health Organization, that's a traditional exclusion in our policies, that they were not going to pay for it. And we were very concerned, because this was going to mean another breakage in the trust that we have between policyholders, or a break in the promise that insurance company does to the policyholders. I'm very happy and I'm very glad that it's the opposite. As Dr. Baruch have mentioned in his presentation, the insurance company have actually stepped up. They have a step forward, and not only they're covering for COVID, but actually they are eliminating some of the barriers, some of the copays, or some of the out-of-pocket expenditures. Not only that is the right thing to do for our clients or for our insured, it's not only the right thing, but this has a secondary effect. The providers need money, correct? As is mentioned as well, COVID is not that profitable. So if in addition of providing a needed service, they have to go and chasing the individuals to collect those out-of-pocket expenses, it's really burden. It's really burdening on the provider. So we're really happy that we're seeing that most of the clients, not only they're covering for COVID, but they're actually eliminating barriers are covering or out-of-pocket expenses. In addition to that, there is a big difference on the cost of COVID. For the privates in Mexico, a COVID case, it may be $20,000. We have some COVID cases in the US that are close to $500,000. So there is a big difference in the cost of COVID. So when we look at the impact in the short term and the impact of COVID, we really don't know yet, or there is still a certainty that if the delay on the elective procedures, because as is mentioned, people do not want to go to the hospitals. I actually heard in CNN the other day a line that stayed with me, that now people look at a hospital as the place that people go to die. So they don't want to see a hospital. So they're delaying procedures, or they're choosing telemedicine or telehealth. And so the delay on those expenditure, or the reduction on those expenditure, we hope that is going to cover for the cost of paying for COVID, but we're not clear. And definitely, like Dr. Baruch said, if I will be an actuarial right now, I'll be doing a lot of numbers, because you may not have those claims today, but definitely they're going to come, and they're going to come at the same time, which I'll be very, all this insurance company and with the tightness in the working capital, they have to be working, making sure that they're going to have the ability to pay those claims, correct? Another thing that is mentioned, and of course, the expansion of telehealth services. Just to make it as a side note, all of a sudden, in a matter of weeks, all our clients start coming to us asking for telehealth and build that telehealth. Now, our clients usually are international insurance companies, and they do not want to deal with a different provider in every country in Latin America. Surprise to us, there was not a solid telehealth solution covering the whole Latin America. There was not one that existed. So we needed to roll our sleeve, and we decided to create one. And not only that, but there was quite a difference in laws and regulations, as Flavio has mentioned. But now some of the lessening of the regulations have allowed us to really provide much more services in telehealth, so not only the medical side, but the behavioral side and the nutritional side, and covering those needs in a holistic view, because people are at home, they don't want to go to a hospital, and they call, they feel they have something, they may have anxiety. So behavioral health, if there was not a conversation about behavioral health in Latin America a few months ago, today, I'm happy to report that 5% of all Latin Americans have access to behavioral health thanks to Global Excel. So we've been building those networks as fast as we could, so we can give a single entry point to their insurance companies. Not only telehealth have replaced that visit to the hospital or going to the primary physician. A lot of the process that they used to be managed on the physical world have moved to the virtual space or the digital space. I'm going to put one example. When a company wants to sell a policy, a healthcare policy or a big life policy, they used to mandate to have a physical for that member and to do some lab work. Nowadays, no member that wants to buy a policy wants to see a provider to do a lab work. So we do it remotely, and we send a doctor to the home to do the lab test, so the person doesn't need to leave their house. What we are learning now is, even when the countries open back, members don't want to go back to a provider to do that. They want the provider to come to them. So as we look in the future, there is a new perception of how healthcare need to be delivered. And I tackle a little bit more about that in my next slide. But again, in the impact, very careful in the short term, because definitely in 2020, it's going to be the year where the claims flow is not going to be what the claims flow was. But in the medium term, yes, COVID-19 it probably is going to mean that the insurance companies are going to be able to raise premium because it's in the top of mind of the individuals. And as soon as the statistics that we're seeing of the difference in mortality between having private insurance and not having private insurance in Latin America become public, some of the early statistics we're managing, we're seeing that those with private medical insurance, their survival rate is double than those in the public system. So that is going to create, and we hope that it's going to allow insurance companies to raise premiums and to find, if done properly, a source for new customers. But again, there is a big issue is that the long-term impact on health is going to be significant, because all this delay of care, all these males like me over 40 that have not done their physical this year, or their colonoscopy, or the females that are not taking care of their woman care, or all these diabetics that are not following with their procedures, all this is going to create a long-term issue, because all this delayed on the preventive health. And at the same time, there's a whole new set of expectation of what cover is. We're seeing this company bending over or stepping forward to help the members and offering solutions like telehealth or mental health or behavioral health, nutritional health to the members. Now is becoming an expectation, and it's something that all the actuaries need to be calculating for the future. Even more important than that, I'm very concerned with the medical inflation in Latin America. It's too bad that it brought some statistics, but Latin America, and Willis just issued a report recently. Latin America has the higher medical inflation. It's hitting 12% annually. Just to give us a reference, in the US, it's between 6 and 7% the medical inflation. A lot of the providers in Latin America, they are not making the money that they used to be making, or they are losing money. So we see that in the medium term, there is significant medical inflation. And that added to lower GDP on the countries. It's expecting that Latin America for 2020, the GDP for the region is going to be, except, we put Venezuela on the side, taking up Venezuela, is going to be a 5% reduction of GDP in 2020, 2021, who knows? But again, we all know the direct relationship between premium sold and GDP in the world. So again, profound impact. COVID is going to have a profound impact. 2020, make sure that we understand the claims flow, and in the medium term, be sure that our pricing is correct, and we engage our marketing teams and our underwriting teams to how we're going to get this new set of customers, because more people are going to be or wanted private healthcare, because the public healthcare that we're seeing in some of the pictures from Dr. Brooks are going to be overloaded. And then, it's all about being optimistic, and it's all about looking at the future, correct? That's where we get paid. And for the last month or so, I've been meeting with all the big consulting firms in the world, you all know the names, and, for them to tell us how do they see the impact, how we're going to adapt, where the future of healthcare systems in Latin America looks like. And I took just this a screenshot for one that I saw, and I'm sorry, but I don't think they got it. I was very, very disappointed, because they are saying the same things that they were telling us a year ago or 2 years ago. Yes, the power of technology is going to be important. Yes, we all know that remote healthcare, it was going to take a bigger share of the delivery of care in Latin America. We've seen that in all the mature countries. It was just about to happen. And then they got this idea of, we need to align value through innovation and new business models. Gustavo will tell you that's very hard. That's easy to say, very hard to implement in the insurance world that is so regulated. And then the famous, you gotta leverage, collaborations between public and private is welcome, but it's very, very, very difficult. So I actually very, very disappointing. I'm really looking forward to forums like this one to become the thought leaders or how healthcare's, or what do we need to do in healthcare as soon as we start looking beyond COVID. And I want to finish with, yes, what my view is. This is what I engage in the insurance companies or my clients every day and how they're engaging with me. And this is the beginning of a framework that, you know, we look forward to in the next sessions that we do about the future of care, how it should look like. But I believe that we insurance companies, particularly in Latam, they need to move from sick care to healthcare. And what do I mean with that? What do we mean with sick care versus healthcare? Everything, all the process, the financial flows, the medical care is around you are sick, go to a place that we cure people and we'll cure you. And when you're cured, your transaction is finished. No, that was yesterday. Actually, I broke my arm. I go to the hospital, they fix my arm, I'm out, case done. I don't hear from anybody anymore. Today, that's already unacceptable. Today, I cannot think of a single client that is not realizing the next two items that actually the two panelists before me, they highlighted. Care is just being more about just being sick. Care is having a holistic perspective of the member. Care is are you eating correctly? Are you doing your proper exercise? Are you doing your preventing care? If you're diabetic, so are you doing your human care? So care is just more than being sick. And the care has to be delivered to you. If we look at the recent past, it was doctor-centric, correct? You'll go to the doctor, you wait in the waiting room, and when he's ready, he sees you. You go to him, you take a day off to see him. Now with telehealth, that's out of the window. I see the doctor when I want to see it. I'm going to see a doctor from my house. And if I need a prescription, he's going to get a prescription delivered to my house. It takes me half an hour, I'm done. I don't have to take a whole day off. But in the future, really what we want is to make sure that people, as an insurance companies, we want to make sure that the people that depend on us, not only they are healthy, but they stay healthy. And for years, we've been talking about wellness. I didn't have a single client that wanted to pay for wellness in Latin America. Now they are all asking me how they can get into wellness and make sure that those people that are at home and they have chronic condition, what are we doing with disease management for the people with chronic conditions? We know that diabetics for countries in Latin America is becoming epidemic, like in Mexico. What are we doing with those? What are we doing with the people that do a COVID texting, they get COVID, and we tell them the most frequent answer is go home and quarantine yourself. And then what we do? Who's monitoring that COVID patient? Who is monitoring that, is your temperature raising? Is your oxygen level? Go to a hospital. And if you go, how are we going to guarantee that there is a bed in that hospital? So how do we make sure you're healthy? And how do we keep you healthy in a proactive way? So I'm really looking forward for your questions about the impact of COVID and how this future of healthcare in Latin America needs to be, and how, like I started, how Gustavo, Cqcs, and everybody that is working in insurance and innovation, we can create this environment of collaboration to really take the next step. Thank you.
I love it.
Short and sweet, my friend. I tell you that
I love it.
I'm not a PowerPoint guy. Yeah.
That's amazing. That's what we're talking about. As Flavio told us, who put the insurance industry in the digital? Wasn't the IT guy? Wasn't the CEO? Was the COVID?
Exactly.
Who want to make us turn on for the wellness movement? Now, we have been hearing a lot about that. Last year, we spent some time in the US with my family, and kept my working in Brazil, and was very interesting because I didn't lose no clients. Everything went all right. I lived my life on Zoom. All my clients started to contact me remotely, and I were there already. And when COVID came, my family and myself, we were trained for this moment remote. It's not virtual. We're people, you are people, I'm people. We are remote. We're not virtual. Is the AI machine, the Bia from Bradesco. But the great point you brought, I think I would like to make 3 points on it. I have very good questions here. One thing that you brought, it is very, very, very useful. We cannot live anymore with the old answers.
Correct.
We have the same questions, but you have different answers. Second, what kind of care people will expect after this remote experience? It brought us 85% of reimbursement being digital. That was ready for 2 years ago, 3 years ago. It's not a new thing on Bradesco. I'm a Bradesco client, so that's not new. So now people can start to use that to get the value of it, feeling more healthy, staying at home. So that's the changing of this mindset will impact much more than people expect.
Fine.
And
Correct.
it will last longer. I love the representation, especially in the end. Let's talk about being healthy.
Mhm.
COVID is not that strong if you're healthy, and I'd like please to ask our other Victor to bring to the room Lior and Flavio and Tar, and let's start our Q&A session. Thank you so much, Victor. I love it.
You're welcome. You're welcome.
That's a second. Let me see what happened here. Let me get in again. Because I am also let me see here. Because I am here, but also as a attendee, so I can have the user experience. When I fell down, I see everyone's very nice Q&A session we're gonna have here. Let me check it out for our team. Just a second. Everything's okay. I beat me last year, but I'm not sure about that. So, okay, let's move it on. And questions for everybody. Thank you so much, the attendees, to provide us so very nice questions. You all did great. And we're going to start here. Let me see from the beginning. And I will ask that for Mr. Lior. João Paulo Moreira asked us, Lior, you believe the increase of the global investment on public health service? How does...
Yeah, so interestingly enough, from 2000 onwards, public healthcare expanded and investments have increased gradually. What happened was literally 2015 onwards, it has plateaued. So we had 15 years where in total dollars, especially in Latin America, investments were not as heavily as required. Now, this is actually I wouldn't call it a tricky question. It's actually a very important question. Because when we look at our landscape, we're talking about Latin America today, not everything is about investing. We could pour literally billions and billions of dollars in public healthcare, yet services would be substandard and not optimal. I strongly believe that what happens in this landscape is terrible management, terrible utilization of our resources. So private and public relationships and entrepreneurships have resulted in very positive ways. Why? Because it's the public money versus private management. People have vested interest on things to work rather than just pouring money and let's see what happens by the next election. I'm sorry, I have a very blunt way to respond things, and whomever has lived or is still living in any Latin American country most likely find it unacceptable to have to rely on an unreliable scheme. Private healthcare systems are excellent where they can play their role. They supplement what the state has the inability to deliver. And this is why they thrive. This is why they're so good at what they do. But from a healthcare investment perspective, you can pour as much money as you want, and most likely it will go down the drain.
Great. Thank you so much. And Flavio, people here loving you.
How not
First
to
of
love
all,
Flavio?
you're too. Please turn around your audio because we have a few questions for you now. Bradesco Saúde have found their clients more worrying about prevention now during the COVID. Did you realize any change in how they deal with the plan? And if it happens, how would be an impact on the plan's prices?
Okay, I think as Lear early said, and also Victor was saying as well, we have some of our claims related to things that are not emergency. It's now they didn't happen here. So in a cash flow or in a small vision of time, actually we are having a better loss ratio. But of course, I agree with my colleagues, and Bradesco Saúde itself has made some technical reserves, because we understand that a great part of these events will come up in the near future, and even in 2021. Actually, we make a joke in here in the company that 2020 and 2021 going to be the same year, due to people are not going to travel for holiday, and we're gonna not have carnival. So all the the period and all the seasons that we used to see in the claims behavior actually is going to be very different this year and the next year. So in the short period of time, we don't see actually the claims are very well behaved. In our relationship between clients, we will come up with all the transparency needed. We of course understand the difficulties and the difficulties of this period that companies are facing, and we will try to come up with arrangement that can meet the expectation of the clients, and also make the minimum equilibrium so that this partnership can go and move on. So this is how we our team, the mindset of our team, and the approach that we are having with our clients. Also, I would like to say that we were in the process of making all new kinds of reimbursement arrangements between the network. We continue to put in place a primary care network, preferred primary care network, in order to better make health delivery and coordinate care, and also the increase of our beneficiary initiatives regarding chronic disease program management and things like that. So all those things combined, we were able
from the last 3 or 4 years to decline the healthcare inflation, what do we say? So we are in a better position, a better shape in order to have those kinds of discussion and agreement with clients.
Great. Thank you very much, Flavio. And Victor, Gustavo Correa says, that's the great question. Focus on health, on prevention. The point it is, how to guarantee the health of the clients, avoiding the increasing of the cost of the claims? What kind of initiatives you think that are available or being developed from the insurance companies to provide this new scenario?
I think, I think that that's no longer, that's an urban legend anymore. I think that the amount of good research and statistics, and we are fortunate that we can look at what is done in United States with wellness and see in a financial, pure, tangible way that if you just take care of 4 chronic diseases, your hypertension, your diabetic, and you just do simple disease management, you are going to reduce the cost of claim. Just to give an example that people that more familiar with the US may know, but not Latin America, Medicare, which is the government of the US, cover the retirees, the elderly, and the poor. It pays to companies that they manage disease management $16,000 a year to keep a patient outside of the emergency rooms by bringing that patient to day clinics where they make sure that they do the proper nutrition, the proper exercise, and the proper follow-up to their procedure. So the numbers are there. And if someone has a doubt with the number, he can talk to Fabio, Leo, or me. We'll be more than happy to show the numbers. What I just tell the client, look, let's look at your claim history and let's focus 1 or 2 diseases for next year. Let's go simple. Let's pick your diabetics. There are so much AI innovation or automated innovation that they just send simple text to the member. Did you just walk up from bed today? Did you walk? Did you drink 5 glasses of water? And if they respond, the way they respond, it creates an alert. So you call back. And if you have a conversation then you can send a doctor or you can bring them to the clinic. But the ability disease management is the most tangible ability we have to reduce claim. And they say, oh, but what about if I do the investment and that member change insurance company next year? They don't change insurance company that year. And the other thing, if you take care of the member, you're giving him a reason not to change. Because if not that you are following up with him to make sure that he's healthy, and he goes to another insurance company, a traditional insurance company, that all believe their role is just to pay the claim, it's a completely different experience. I welcome, and we can talk for hours about this. I go to a doctor, I do my wellness. They never ask me what I really eat. And I'm strong, passionate about this because when I eat, if I eat okay, like I'm at home now because we are in quarantine, so I'm eating healthier, I feel better. If I exercise, I feel better. But though, I see a doctor, they take my blood, they do a lab, and yeah, they can give me Lipitor for my cholesterol, but that's sick care. That's not healthcare. So there is a lot. There is wellness. There is wellness programs, fantastic wellness companies in Latin America nowadays. Maybe not in the smaller countries in Latam, but we benefit. We got 600 million people, mainly to language. And Brazil had fantastic wellness companies. There are fantastic wellness companies in Mexico and Argentina. I welcome any enough to challenge any provider to work with them. Will commit to, I'll make money if I save me money. I'll do that the first year. I'll invest. We'll do a win-win. That I'll put the program together and I'll make money if I lower your claims over a certain point because the numbers are there. There is no challenge anymore. I don't know, Flavio and Leo. I don't know how you guys think.
Yeah, please feel comfortable to collaborate with that. Because that's very interesting because Mr. Carlo Farangi is asking if the COVID will impact the industry about the structure of the products, if co-participation, or the model for the packs, or the change it's going to have. And my point of view, I have this problem. I always give my opinion. But the point that is, we're going to have the GDP is going to get low. Companies are having trouble. The costs are going to be increasing. So I don't see a way that if we don't redesign the existing models to the future of protection. Yeah. So that a lot of people are thinking about that, and we have been talking about that from a long time.
Mm-hmm.
I used to work for accident health reinsurance in the 90s, 1995, and we were talking about that since then. And until today, it's very hard to implement, especially in Brazil where I live. And you think, Leo, that we're going to have any change in the design of the plants?
Let me jump here, Gustavo.
Okay,
Yes,
please, Flavio.
definitely we have to change the design, and actually we're doing that. First, just to I'm totally agree with the opinion of Victor and this mention that the client is everything that we do, it's client centric, and the experience and everything that we have to do, it's on the client's perspective. We are some of the things that we are doing is making new products that by design are very connected. So first, this notion that what a big network, a bit referred network, it's something that sells the plan. So this is totally in the past. Having a small network, but very efficient, with high quality and connected, this is the right approach that the product could have. So we are launching some of these products, region-based, because health, it's local. Although we have, and sometimes we'll sell a national, most of the time we sell a national network. Oh, if you go to Manaus, you can use. If you go to São Paulo, you can use. But actually, health, it's a local matter. Of course, it can get nationally or even globally for some specific treatments. But in general, it's a local matter. So making a product that it's customized for that region, connected with high quality of network, providing actually a primary care choose based on very high standards numbers, getting together, coordinated care. These are the things that was already in place, but I think now it's somehow this pandemic will excel at least the mindset of the human resources that it's buying that product, or even by the mindset of the small business or their own family owner must have, and actually it's moving to that direction.
Yeah, just to complement on what Flavio and Mr. Navarro have mentioned, Flavio actually touched on a very important point. In the past, when you used to pitch wellness to clients, it was very difficult to monetize that. So clients would actually buy or purchase an add-on to the product, wellness, saying, what am I getting out of my dollars? Can you show me actually that I'm getting the benefit? I can walk in as a doctor and tell him, yeah, actually, someone admitted into the ICU for 5 days because of a decompensated hypertension or diabetes or a stroke or having to amputate a limb with following difficulties to work is way more expensive than having someone taking the medication regularly and having their glycemic levels reviewed on a regular basis. The thing is, people tend to see it from a different perspective. It's very making changes on healthcare is quite difficult. So when you have a certain lifestyle, when you have a certain way to behave, and you're not that sick, you're literally turning away from the normal curve, bringing you to the normal path might be easier, quicker, and cheaper than waiting for you to be completely off track and then several paths back into the normal one. Very interesting discussion. I think that Mr. Navarro touched on 4 critical points, which are hypertension, diabetes, cholesterol, and sleep management. In the US, we have even different types of approaches. So it may be throughout a coach service where we would incentivize people and contact them on a regular basis, either through the phone, either through a video conference, checking on their progress. We establish a goal, we establish a metric, and we make sure that there is progress and how can we help throughout that coaching program that they achieve their goal. There are also financial incentives, as interestingly as it sounds, but someone who would achieve a certain goal, such as having a health risk assessment. Number one, first and foremost, you gotta need to know what is your current status and where do I need to shift you from. So you receive a certain amount, a financial amount, that can be as $50, as $100, but picture how insane that might be to a regular employee saying, so you're telling me if I go and get my health risk assessment, just my physical, right? On a yearly basis, I'm gonna put $100 on my pocket, meaning if you have a deductible or you have co-insurance, then that money can be used over there. Yes, I'm telling you that. That's a huge incentive to people so they can utilize those specific incentives.
First of all, thank you all. Ismar Bork Filho asked about how pandemic impact life insurance. I would like to invite him for next step on August 27th. Please, Ismar, come back. We're going to have our friend Marcelo Mello from Sul America and some international folks here to support on this issue. Please help me to bring the people today. We have a great success. But we have here, Lior, we have, where's the lady here who asked us? Samantha Barbie asked Dr. Baruch, how about the information, historic information you present us? What are your provisions? How long is gonna last this pandemic?
Yes, that's the question.
That's a very
Dr. Baruch, we believe that he can answer that.
I wish that I had a crystal ball because I would provide my friends with the lottery numbers and all the good things. Unfortunately, it's a very tricky question. If we go to science and how all the previous pandemics have ended, it's literally about herd immunization, right? Either half of the population in a certain continent has died and the strong ones, because of natural selection, have survived, or we have created a certain mechanism to protect us humans against that disease. So if a certain disease is caused by a bacteria, there's antibiotic for that, and so on and so forth. In this case, it seems that herd immunity is going to be achieved either because the virus is going to mutate so much that it's going to destroy itself, or there is the vaccine route. So as we speak, there are several vaccines and clinical research lines of study, and we are seeing positive results, although they are literally blurred. It's a little bit difficult to affirm anything, whether how much of that immunization is going to be required. Are we going to need a booster immunization, such as we need with tetanus, or we need with measles or mumps and so on? Is it going to be a one and only shot, and then we're done for good? So then you have antibodies specifically living within your body that will protect you forever, it's a little bit uncertain. So to the lady that has asked the question, my apologies, I cannot answer that, but I can only predict what most likely will happen in the future.
Thank you very much. One thing that very interesting, and the guy here, Andre Martins, and Victor, how the hospitals are reacting if the competition from Walmart clinic and Walgreens Day clinic. I didn't got.
Well, I think that what we are seeing is in the larger countries, this is a model that is applicable to the US, Brazil, Mexico. You are seeing that there is a whole value change on the delivering of healthcare. So there is this room for what we call the mini clinics. What Walmart is doing, what is really great is what the pharmacists used to do the old times in Spain. You go and you talk to someone that has medical training, doesn't have to be a doctor, maybe a technician, simple question and answer. I think that supported with telemedicine is going to be very powerful to lower the cost of care in the United States. And I think that we need to preserve the beds in the big hospitals for the big care. I think that this idea that the Spaniards share with the Brazilian, that we go for a hospital for everything, is something that we need to move away. I think we need to look about like an escalation of care. If it's something, go to a mini clinic or go to a walk-in clinic or an urgent care and leave the hospital when it's something that is immediate and urgent or for elective. So, but that's something that in the US with 300 million, we're having this optimization of the delivery model of care. And I'm pretty sure that, like, for example, what Keralty is doing with AXA in Mexico is an example of that, of creating a smaller clinic for primary care. Is something that is called Sanitas, I believe was the name, in Colombia. I think that vertical integration of the small retail clinic as a friend to the hospital, it would allow us to optimize the beds on the hospital. If not in times like COVID, everybody rushing to a hospital. Unfortunately, what happened in Spain, people die on the hallways just because they couldn't go to seek care. So I see that as a really positive. I welcome Flavio or Lior to give me their comments, but I see that ecosystem of care is part of the solution.
Yes, I totally agree. Sorry, Lior, go first, please.
Please, Flavio.
Okay, so I agree with that vision. I think it's positive for the network, the whole healthcare network. But I think we need to pay attention about how can we integrate information, data, and also healthcare service. I think this is a big question.
That's a big.
Especially now with the digital transformation, I think one of the big challenges is not to actually mimic what is happening on the physical world. In the physical world, we have silos. So the doctor don't speak with other doctors. The clinics don't speak with other clinics. When you go to the hospitals, you don't get information, data information, or health information about the patient, and this information don't flows in a smart way. So we understand that on this new transformation, this digital transformation, this is something that we need to be aware of and make the change, the change that it's going to be needed in order to actually provide a more valuable care. So to have a very good point of care of primary care, it's very good. But I think something that we have to pay attention is how can we integrate that into a system that makes efforts for providing valuable care for our clients.
Absolutely. So electronic medical records, right? A full integration that unfortunately exists or doesn't exist throughout many countries. And Mr. Flavio, you're spot on. Mr. Navarro got a very interesting perspective as well. So the integration with the smaller brick and mortar players, right? So CVS, Walgreens, Walmart clinics, those folks are not actually competing with the hospitals. Those folks are actually to serve a local community, say a surrounding of 8 blocks, where you're going to have primary care delivered. You're going to have your regular PCP, primary care physician, checking on you. A good day to do that would be on your birthday. So you get a letter on your mail, or you get a text from someone saying, hey, happy birthday. By the way, step in for your annual health checkup so I can see how things are going on your end. Those guys will certainly play an interesting role from a regional community perspective. I personally don't see them competing with hospitals, but mainly probably driving what Flavio has mentioned earlier. They could probably take care of the vast majority of cases that are definitely not related to urgent care and certainly not an emergency room. You walk into an emergency room, your hospital bill is most likely going to be 80 times more than it should be from a regular medical office.
Great. And my friends, we will need to quit that sometime. Thank you very much. Please, I would like to ask Mr. I have a personal curiosity about players' health. I would like to ask Tyre, so we first until now. Tyre, how you see the perspective to expand, because in Latin America, we are very strong on soccer players, and I know that you have been working very strongly with soccer association in the United States. We call that football. Real football is not what we play here, not the American football. And how you think that there's any chance to replicate that in our region and give some direction how we could handle that?
I think we've started to actually branch out. I think we have the Belize national team is on our platform. We're managing all the injuries for them. The Belmopan Pirates, which is in Belmopan, Belize, we support them as well. A number of organizations in the UK. So I think we're definitely starting to grow in terms of a global perspective, in terms of how these organizations looks at managing on their overall health and safety of their athletes. And because we created a health management application, or EMR, electronic medical record for athletes, we're still starting to see that scale. We have over 600,000 athletes we do that with, and we're really starting to see that branch outside of just US. And of course, we have a huge presence in Canada as well.
My friends, I could stay here all night long. Our attendees also, you have more than 160 people here in the room, but we really need to close it now. And first of all, was amazing time. Was really, really good information, fluid, and really to make everyone around to think about it. All the comments here is excellent, amazing, unforgettable, do it again, invite these guys again. So all I could tell you in the name of Cqcs innovation team, that you really helped us to make a remarkable event. You know, we had a very, very untypical experience in the first stop, which helped us to take more care in learning. We are in the way of trying to provide this connection through Latam. You know, the world's globalized and the regions will get stronger, you know, and I travel a lot around. I love wine, so I love Chile, I love Argentina. I have a really shamanic background, so I love Peru. So I have been in Mexico. So I really believe that we can make difference and help each other more as insurance professionals if we get closer. Today, we did a great goal. We did the really strong step on the way to make Latam closer. We have all the registration, all recorded here for people who didn't have the chance to get access to this value raise here is a fan of us. It's perfect. And Erica, top perfect. So all need to say, in Brazil, you say gratidão, gratitude. Thank you so much. From the bottom of my heart, I had a magic day, a magic night, and it will be forever in the history of my life and my company. And for sure, maybe here's the first step to change the reality of the health insurance in our region. We're showing now with COVID that we really need to collaborate more so we can make the stronger views and use this COVID push to make the real change from sick to health. Thank you so much.
Gracias. Obrigado.
Thank you, Gustavo.
Thank you.
Valeu. Diz a vocês que vieram aqui hoje participar desse bate-papo que hoje é um dia onde se fez história no seguro-saúde. Today is a day that we made history on the health insurance business. El seguro de la salud hoy es un primer punto para la mudanza. We need to change it. We need to do that together. We really need to do that together. Please, come with us. Let's go forward. 4 more stops of Cqcs Innovation Latam. Love you guys. Gratitude. See you in August.